Healthcare is supposed to protect life, but in America, it is also an enormous business. So we must ask an uncomfortable question. When healing and profit exist inside the same system, which one is truly being prioritized? This is not an attack on doctors, nurses, researchers, or emergency workers. Many dedicated their lives to helping people, but good people can still work inside a system shaped by financial incentives they did not create. In 2024, the United States spent approximately $5.3 trillion on healthcare, about $15,474 for every person, and 18% of entire economy. Illness is not operating on the edge of society. It supports one of its largest financial systems. America spends roughly 2.5 times the OECD average per person on healthcare, yet U.S. life expectancy remains about 2.7 years below the OECD average. If spending more automatically created healthier people, shouldn't the results look different? CDC study estimated that in 2023, about 76% of American adults had at least one chronic condition, while more than half had multiple conditions. Are we witnessing unavoidable biology, or a society producing sickness faster than medicine can repair it? The CDC reports that approximately 90% of U.S. healthcare spending is connected to people living with chronic or mental health conditions. It does not mean every condition is preventable, but it reveals that long-term illness is the economic center of the system. Much of healthcare still uses fee-for-service payment. Every consultation, procedure, scan, test, or treatment generates another payment. MedPAC acknowledged that this structure can encourage greater volume and intensity of service. The symptoms often pays for activity, not simply recovery. Medication and repeated treatment can save lives, but economically, a condition requiring years of appointments and prescriptions creates more recurring revenue than a problem solved once. That does not prove deliberate harm, but it should make us examine how the incentives are designed. Prescription medicines are marketed directly to consumers through television and digital advertising. The FDA requires truthful claims, risk disclosure, and balance between benefits and dangers. But ask yourself, why must a patient be persuaded to request a particular medical product? An FTC investigation found that major pharmacy benefit managers placed markups of hundreds and sometimes thousands of percent on certain specialty generic drugs. Their affiliated pharmacies collected more than $7.3 billion above estimated acquisition cost during the period examined. Hospitals have been federally required to publish standard prices since 2021, yet the government continues revising transparency rules so patients can obtain clearer, more accurate, and comparable prices. In most businesses, you know the cost before buying. Why should healthcare be different? An analysis of government data estimated that Americans owe at least $220 billion in medical debt. Around 14 million adults owe more than $1,000, while approximately 3 million owe over $10,000. People can survive the illness and still be financially injured by the treatment. Insurance may reduce risk, but it does not always remove it. Recent KFF polling found substantial numbers of adults using credit cards. loans, or borrowed money to pay medical and dental expenses, coverage can exist while affordability remains out of reach. Researchers estimate that U.S. healthcare administration consumes close to $1 million annually. Billing departments, insurance networks, claim processing, authorization systems, coding, denials, and appeals all move money without directly healing a patient. The CDC identified tobacco use, poor nutrition, physical inactivity, and excessive alcohol use as major risk factors behind many chronic diseases. Preventive care matters, but prevention also depends on whether people can access healthy food, safe neighborhoods, time, education, and affordable care. A major international comparison ranked the United States last overall among 10 health systems, but second for the actual process of care. That distinction matters. The problem may not be lack of skilled healers. It may be the larger structure surrounding them. There does not have to be a hidden board ordering doctors to keep everyone sick. A system can produce harmful outcomes simply because every organization follows the financial incentives placed in front of it. There is no reliable evidence that every major cure is secretly being suppressed, but it is reasonable to investigate conflicts of interest, patent control, research funding, inaccessible treatments, and whether long-term management can sometimes receive more investment than prevention. Hospitals require workers, equipment, buildings, research, and funding. Pharmaceutical development can be costly and uncertain. Profit can support innovation. The real question is what happens when maximizing revenue becomes more powerful than maximizing public health. Who gets paid when illness continues? Who gets paid when health improves? Which treatments are medically necessary? Which are simply better reimbursed? Who controls the price? Who funded the research? And can the patient clearly understand every available option? Questioning the system does not mean rejecting emergency care, medication, surgery, vaccines, or professional medical advice. It means requesting transparency, asking about risk and alternative, seeking opinions, understanding costs, and becoming an active participant in your care. Health must remain financially sustainable, but sickness should never become the product. Patients should never become inventory, and treatment should never become more valuable than healing. The question is not whether medicine saves lives, it does. The question is, who does the system ultimately serve? Do not fear medicine. Do not blindly worship it either. Understand the system, follow the incentives, protect your health. Stay curious and question everything. Truth through a Sagittarius lens.